Welcome to Bad to the Bones, the podcast where we discuss everything related to orthopedics, joint health, and living an active lifestyle. Welcome to Bad to the Bones podcast. I'm your host, Debbie Rohde. Today's topic is about injury prevention in young adults, a topic that's really hot right now. The kids are getting back into sports, and we've got an expert here today to talk about how to prevent your kids from getting injured during their growth spurt years. Our special guest today is Dr. Ravin Patel. He is with Premier Orthopaedic Associates since October of 2024. And we're thrilled to have him here today. Welcome to the show, Dr. Patel.
Thank you. I'm excited to be here.
Yeah, let's talk a little bit about the unique perspective you bring to Premier.
Yeah.
You are double board certified sports medicine and family medicine, and you're now specializing in occupational medicine, correct?
Yes.
And that's a great field to specialize in. I know you're bringing a lot of passion to the team of Premier, helping the performance of all the professionals out there. What would you say was the most attractive thing that brought you to Premier?
Yeah, so I actually rotated with Premier Orthopaedics as a resident. So I had just seen how the practice was run, and all the physicians were very qualified. I'd heard such great things from the patients, so wanting to be a part of a group like that was very natural. And meeting with some of the surgeons and kind of sports medicine people, they made me feel very comfortable and was excited to join.
Was being in orthopedics something you wanted to do your whole life, or did you really want to be family medicine? How did you get here?
Yeah, I knew I wanted to do something in healthcare. I found out about sports medicine in medical school, and then realized there's a physician that can help take care of athletes and people who enjoy being active, and that's right up my alley. So that's kind of how I made that transition into sports.
Nice.
Yeah.
Nice. And how do you feel that your transition into occupational medicine? I guess it's a good blend, right?
Yeah.
Of sports and family.
Absolutely. I think it translates well just because occupational health, you're dealing with a lot of musculoskeletal issues that come up at work injuries, occupational hazards, and that kind of relates to my family medicine background. So it's a good combination of both.
Yeah. Nice. Well, we're so happy to have you here today. I know that the information we're going to talk about is very valuable. It's good for parents, coaches, and athletes alike. So let's jump into it. Today, we're going to talk about why injury prevention is different in growing athletes. So when I think of a young athlete, and probably most people, they're probably thinking they're young, they're strong, they're vital, we can push them as much as we can, but that's not really the case, right? So when young athletes are in their growing years, they're pretty susceptible to injury. And you're going to tell us why, right? You have some reasons why that is.
Yeah, some reasons why. So I think the biggest thing to realize is just pediatrics in general, kids in general, they're not just small adults. Their bodies are very different. Tendons, ligaments, they're growing at a different rate than the bones.
Yeah.
So bones, if you look at pediatric x-rays, they're not always all fused, and growth plates and different things like that people have heard of close at different ages. So they're susceptible to different injuries at different ages. I think they're more active, they're more playful outside. Like most adults aren't just, they kind of go to work, come home, they're not putting themselves at risk, but kids have no fear. They'll do whatever in sports and all this. So they are predisposed to injury in that sense.
Now, do you think coaches are aware of this type of, growth of how these young athletes are growing at a certain speed and need to watch for those things, or they're just like, game on, let's go?
Yeah, I think it depends on the coach. I think it depends at what level you're playing, what kind of resources the team has. Do they have a coach that's used to a certain sport and knows at what level can you push certain people? But then the nature of some sports, it's go 100%, and there's no injury prevention or thinking about injury. It's just, let's see how far we can push the kids.
So at what age are kids less susceptible to these injuries because they're no longer in a growth spurt?
Sure. I think when they're skeletally mature, you could say that they're less susceptible, but I think at any age you're pretty susceptible. And it all depends on how you are as an athlete, how conditioned you are, what kind of recovery you do, how well your musculature and just kind of your genetic build is, and how you work out, and then how it translates to your sport. Oftentimes, if you're playing a high collision sport, rugby, football, basketball, these contact sports, you're just at risk. Even if you're, have the best body and nutrition, everything, it just takes one misstep or someone hitting you the wrong way to cause an injury.
Well, what are some of the typical injuries that you're seeing during these growth spurt years?
Yeah, so we have a lot of some of the pediatric apophysitis, as we call them. The biggest one I always hear, even parents know about it, like if you have anterior knee pain with like Osgood-Schlatters, and it's just kind of pulling because the bone hasn't fused at the bottom of the leg, so you're having the tendon pull. So you get a lot of kids who nothing happened, they just started having knee pain. So we have that, and then a bunch of injuries from the pediatric standpoint are fractures, like kids will fall on their hand and then break their wrists. You'll have ACLs. That's when kids are transitioning more to the high school years.
Yeah.
Some non-contact injuries like that. And then a big one I'm seeing just because of what I do is concussion. So you have kids who, in basketball will go up for a rebound or they'll collide with someone on the court or field. So I deal with a lot of pediatric concussion as well.
That's interesting. I don't think about concussions as much in the basketball arena as I do with football stuff. But yeah. I mean,
obviously with football, there's a bunch, but people forget these other sports. Like we have swimmers, we have lacrosse players, and even some of the non-contact stuff where you just fall on the track. If pole vaulting, they fall from the top and hit their head. So
parents on the sidelines, we always hear their passion. Like, they want their kids, they want the best out of their kids. Game on, let's go, give it all you got. But there are some warning signs that parents should be aware of when they're watching their kids in a sport. And what would they look like?
So I think to break it down, there's like two big buckets or categories I put it into. The first one's mental. Just kind of checking in with your athlete and your child to see if they're enjoying the sport. Because I think that a lot of parents, they're like, oh, I want my kid to play baseball or whatever it is. And then, checking in with the kid as they progress in different levels. Because a lot of kids lose interest, but fear, they don't want to tell their parents, like, I don't like this anymore. And just kind of see if are they excited to go to practice, excited to go to games. I have kids who I see as athletes who are like, you're out for 2 weeks. They start crying. I have kids who are like, oh, thankfully I don't have to go back. So just kind of checking in with that and seeing burnout as well. Even kids who enjoy sports get tired because now you're not only playing just for your high school, you play for a club team and then a national team, then, the travel, because on the weekends you're driving 6-7 hours to go to a tournament. And then I hear some of the stories, and I've seen it firsthand, like kids play like maybe 7 games in a tournament in a day, and then they're driving back 7 hours. Then, you still have to go to school. You're not like a full-time athlete.
Right.
So just looking out for those causes of burnout. And then from a physical standpoint, ailments, injuries that don't get better within a reasonable standpoint. If you play 7 games, you're like, oh, my back hurts a little bit, but then by Monday it's great. That's awesome. But, if your kid keeps coming up and asking for medicine, like no healthy kid's asking for like Tylenol or ibuprofen, they're adults. So when they're asking for more meds, you notice other things. That's why it's important for you to go to a pediatrician on a regular basis as well, just to rule out any of, just make sure all the blood work's good and just kind of normal things to make sure the kid is progressing appropriately.
And so when they're conditioning for sport during these growth spurts, are there certain things, exercises, and just conditioning training that they should be doing outside of maybe what their coach is telling them to do?
Yeah, absolutely. I think the biggest thing is what has become more of an issue recently is sport specialization. I think kids fall in love with one sport and then they play it all year round. So you're only working certain muscles. But if you see like even some of the best athletes who make it to the NBA, NFL, like they could have gone professional in 3 sports. In high school they played. And that's how it used to be. But now with the advent of all these club teams and clinics and all that, it's like, baseball is the most notorious for this. Like, you have a pitcher and it's like they're a pitcher, they're a catcher, they're an outfielder. So you're constantly working their shoulders, but are they really working their core, legs, different other parts of their bodies to unload stress off this one joint?
Yeah. Well, rest and recovery is a very important and overlooked tool. So can you talk a little bit about how that comes into play for injury prevention?
Yeah, absolutely. So I think the biggest takeaway from this from a rest and recovery standpoint is rest is not just, when I'm tired. It's like rest is necessary and should be built in. Yeah,
rest is probably not, you're referring to just sitting down on the couch and chilling out. You're actually like resting the muscles that you're using, correct?
Yeah, because it's, people do want to go like 7 days a week. They have aspirations to like get to the next level. But even elite athletes, they take breaks. They work on stretching. They work on their nutrition. Sleep is the biggest thing because I think, especially with kids, it's like you're at school all day. You're at practice till like 6, 7, 8 o'clock at night. You have homework. You're not going to bed till midnight. You got to come back again at like 6 a.m. Wake up, So kind of prioritizing on the weekends, getting more sleep, and just kind of doing everything you can to provide your athlete with time to sleep, recover, eat nutritious foods, stay hydrated, things like that can really help.
So what can parents do to work together with coaches? I mean, what if the parent is seeing that the coach is really overworking their kid?
Yeah.
I mean, do you think that's a thing?
I definitely think that's the thing. And I think especially children who are, talented, get
Yeah.
kind of, the coach expects more out of them. They want
Yeah.
them in an extra league or extra practices and training. But I think at the end of the day, it's your child, and like, them best. And,
Yeah.
the coach obviously has the child's best interest in hand, but just kind of having an open conversation with them about, we've noticed these things on the field and at home. I think dialing it back for X amount of time just to see how he responds to it, he or she. So
Yeah.
I think it's important. I think parents are also responsible for that as well as the coaches.
What kind of advice would you give to parents in those situations where, they have an athlete that might be being pushed too hard?
So I think it depends on the level and like I always ask athletes that come into our office, I say, what are you training for?
Yeah.
If it's in the summer and your league is in the spring, it's like, all right, well, we have a whole year. Like, I think taking a rest right now is good. Or
Yeah.
my spring football guys, I'll be like, your season's not until November. I think we can take a break now. But
Yeah.
sometimes there is that delicate window of like, I just need to push 2 more weeks, and just kind of setting expectations of like, all right, we'll let you push 2 more weeks, but after that, we really need to shut it down and
Right.
maybe cross train and do other things. So I think athletes also get worried like, oh, I can't do my sport, I'm going to get out of shape. And I'm like, there's so many things you can do outside of your sport that will help you when you get back and you're healthier.
Yeah. I've seen a lot of kids who are really passionate about their sport. Even in the off season, they're still going at it. Like, they're stretching and conditioning, and some parents even send them to training camps and such during the summer, or the off season. So, I mean, do you think that's a good thing?
I think it's a good and a bad thing. I think that there's a fine balance between you and your child pushing.
Yeah.
Because everyone has aspirations to play at the next level, be the best athlete they can be. And it's not to say that you shouldn't push for that, but I think it needs to be done in a controlled manner. And then there is times to scale it back. There's times to cross train. There's other things that you can do besides just like hitting it as hard as you can every day. Because even any like good strength training program, like I worked at Penn State last year with Division I athletes, like every day wasn't like lift as heavy as you can. Like they had off days. They had like, hey, we're just going to do flexibility, resistance, cardio, different things like that. And I think the cross-training aspect is super important.
So is there one red flag that would come to mind for you that parents should not ignore when they see in their kids?
Yeah, I think the biggest one, especially, if I had to go like lower extremity, I think limping is the biggest like red flag, especially if we're talking like pediatric, like younger kids. Like, if your kid walks normally and starts limping, they're not doing it on purpose or to like draw attention. Like, that can come from so many different things: ankle, hip, knee. And it's better to get it evaluated and kind of see.
Because it could just be like, I remember when my kids were growing up, they would say, like, oh, my legs hurt. And I'm like, it's just growing pains.
Sure, yeah.
And it really was.
It really is, but it's better to get it checked out.
But you don't know.
Yeah, absolutely.
Yeah.
And then I just had, we have a bunch of kids who are like, I was telling my parent for like weeks, for months. Then it's like, oh, it became 2 months of him complaining about it. So then we brought him in. So I think just early on, it's fine to bring them in just so we can kind of have a conversation with them, and then we're able to identify stuff. If we have to get x-rays, we'll get x-rays. But a good exam from one of us can really help kind of parents prevent a long-term injury. What
is one of the biggest myths, if any, that you might hear in this youth sports area?
I think we already talked about the myth is like, you have to train every single day and you have to train as hard as possible. I think that kids, parents, adults, coaches would be surprised that if you made a kid train only 6 days or 5 days and really worked on rest and recovery, how much more they could give on the other 5 days.
Yeah, I think it sounds like it's a really delicate balance between the coach, what the parent wants, what the kid wants. I mean, when you were talking earlier about making sure that the kid is still interested in the sport. Listen, as a parent, when my kid signed up for a sport, you don't quit halfway through.
Correct,
you decided you want to do this.
Sure.
You're getting to the full. You're going to the World Series.
Yeah.
You're finishing out this sport. So I guess sometimes that couldn't be a good thing, or isn't a good thing, because I'm pushing my kid to do something they don't really want to do, and maybe they're not, giving it the right effort and could get hurt.
So I think that's, from that sense, when they're early on, young, and they're like constantly wanting to quit after like 2 or 3 practices, it's different. But it's like, you've been a baseball player your whole life. Now we're about to start 10th grade. Do you really want to keep doing this? Like, that's like different when it's like, I don't even like this anymore. My shoulder hurts every time I play. Like, I'd rather, do swim or basketball or like any other sport. So I think just reevaluating and making sure your kids are still interested and engaged and they're excited about it is super important.
Yeah, that's good advice. I mean, do you think that it's good for parents, or is it even a thing that parents would want to take their child to an orthopedic specialist for an evaluation before they start a sport? Is that a good idea?
I believe there's utility in that. I think just explaining to us, like, if someone came to me and then said, like, what, because I do a little bit of that when kids come in for an injury. I'll
Yeah.
have them like squat and just kind of see what their range of motion is, flexibility. And I'm like, oh, you have no like hip mobility, or you are lacking in like glute musculature, or like your rotator cuff's very tight.
Yeah.
But you
They're
don't
probably
see
like,
that.
Mom,
Yeah.
I don't want to go back to him ever again.
I know.
Like,
but it's good feedback, and I think
Yeah.
the kids even realize, like, yeah, every time I can't move my hip past this point. So
Yeah.
it's certain things for them to work on, and ultimately this will help them perform better and prevent injuries in the long term.
Yeah, that's good. That's good to know because, I always say, like, how do you know your kid is physically able
Yeah.
to perform this sport, right?
Sure.
Just because they have an interest in being in baseball or basketball or
Yeah.
swimming, So that's good. That's good to know.
Yeah, and a lot of it's like type of athletes that
Yeah.
like the sport attracts, like swimmers in basketball, like taller, more slender athletes. Like football's obviously you're like bigger guys who
Yeah.
are like so like certain body types are good for certain sports, but
Yeah.
you see outliers all the time, like really short guys who are awesome at basketball, really short girls who are great at soccer and things like that.
Right. Yeah, absolutely. Well, I think some key takeaways today is that conditioning during growth should be more about injury prevention, right?
Yes.
Than pushing to peak performance.
Correct.
Would that be?
I think that's very valid. I think by focusing on injury prevention and just kind of optimizing the child, like you're going to inevitably help them perform better,
Yeah.
and they're going to be happier and healthier in long term.
Well, I was just going to ask you if there was one thing that you would tell parents, but I think you just said it.
Yeah.
So,
That's a
yeah,
good takeaway.
that it's all about just, making sure that you are observing your kids' potential and their ability
Sure.
and looking for warning signs of any pain.
Yeah. And I
So-
think the bigger takeaway is your kid is playing this sport and is getting so many other benefits from it besides just athletic and like moving on to the next level. Like so many things about responsibility, teamwork, showing up on time, hard work, and
Yeah.
just that's like the bigger takeaway, because most kids are not going to be D1 athletes and professionals, So
Yeah.
I think just keeping your kid in sport, keeping them healthy to be able to hang out with their friends, socialize is like super important.
Yeah,
So,
I agree.
because I know like a lot of the parents I see are like, my kid's not going to wherever the Eagles or anything, but they
Right,
love their sport. And
right.
like,
Yeah.
you have to help them maximize the time they have, because most kids will only play sports from like 3 or 4 to 18, and then
Yeah.
that's it forever. So my goal is to just kind of keep them as happy and as healthy as possible while they're in their like athletic peak and playing on teams and things.
Sounds like a good goal, a very good goal. Well, Dr. Patel, thank you so much for sharing your insight and your
course.
expertise. We're happy to have you. I think it was incredibly informative for not just parents, but for coaches and athletes. To our listeners, thank you for listening to this episode of Bad to the Bones. Orthopedic health is constantly evolving, so we encourage you to subscribe to our channel and stay on top of the latest news and different advice and tips that we can offer for young athletes, seniors, and competitive athletes alike. So thank you for joining us on today's episode. We are all across southern New Jersey. We have offices from Deptford to Linwood, New Jersey. You can call or text us at 856-690-1616 to schedule an appointment with Dr. Patel or any of our other orthopedic specialists, and we look forward to seeing you. Until next time, stay healthy and take care.